How can I cope with traumatic grief? Coping with traumatic grief can feel overwhelming. This type of grief happens when you lose someone suddenly or violently. It can lead to feelings that overlap with post-traumatic stress disorder, or PTSD. Understanding how to navigate this complex emotional landscape is crucial for healing. First, it is important to recognize the nature of traumatic grief. You may experience intense longing for the person you lost, intrusive memories of their suffering, or difficulty accepting the loss. Feelings of guilt or anger can arise, and you might find yourself avoiding reminders of the person. These symptoms can resemble those of PTSD, such as being easily startled, having nightmares, or feeling emotionally detached. If your grief feels severe or lasts for months, it might be time to seek professional help. A mental health professional can help you address both your grief and any underlying trauma. They can provide you with the tools you need to cope effectively. There are several therapeutic approaches that can be beneficial. Cognitive behavioral therapy, or CBT, is one effective method. It helps you identify and change negative thoughts and behaviors related to your loss. Variants like trauma-focused CBT and prolonged exposure therapy can be particularly useful. Grief-focused therapy is another option, designed to help you process complicated grief and rebuild connections with your loved one in a healthy way. Eye movement desensitization and reprocessing, or EMDR, is a therapy that can help reorganize traumatic memories. This can promote healing and reduce distress associated with traumatic grief. Group therapy can also be helpful, as it provides social support and shared experiences that can reduce feelings of isolation. When dealing with PTSD symptoms related to traumatic grief, it is important to acknowledge that intrusive memories are natural and temporary. Talking about your feelings with trusted friends or family can help you gain perspective and feel less alone. Engaging in activities that bring you joy or a sense of purpose can also help you rebuild your life after loss. Emotional challenges like guilt or unresolved conflicts with the deceased can complicate your grief. Therapy can assist you in working through these feelings, fostering healing and understanding. Maintaining a sense of continuity with your loved one is also vital. This means finding ways to keep their memory alive in a positive manner, rather than seeing the loss as an absolute end. Self-care is essential during this time. Prioritize sleep, nutrition, and physical activity to support your overall well-being. It is important to avoid using substances as a way to cope. Seeking social support from friends, family, or support groups can also be beneficial. In summary, coping with traumatic grief involves understanding the interconnectedness of trauma and loss. Seeking professional help tailored to your specific needs is crucial. Employing coping strategies that promote healing can help you find a renewed sense of life. Always consult qualified mental health professionals to develop a personalized approach that suits you best.